Welcome to week 2 of Aprendiendo Juntos, Learning Together to Give Care. My name is Carol White. I'm a registered nurse and a professor at UT Health San Antonio. In this module, we'll discuss behavioral and psychological symptoms of dementia, also known as BPSD. Together, we will identify some of these behaviors, causes or triggers of the behavior, and then discuss together strategies to help you manage these behaviors. The behaviors you may be seeing with your family member living with dementia are related to their brain functions becoming more impaired as their dementia progresses. This impairment in function leads to disturbances in perception or how they see their environment, disturbances in how they are thinking, and also in their mood. These behaviors can create significant challenges, both for the person living with dementia and for you as their caregiver. Here on the slide, you see some examples of different behaviors. While these are the most common behaviors, you may not necessarily see all of these behaviors with your family member. Common behaviors include refusal of care, such as bathing, dressing, or other activities of daily living, disturbances with their sleep, wandering, and we know from the research that about 60% of people living with dementia will wander away from their home. Repetition can be a challenging behavior for caregivers, and this can be repetition of questions or repetition of entire conversations. You may also see anxiety, depression, agitation, and aggression, which may be verbal or physical. Caregivers report that the behaviors of dementia are often the most difficult aspects of care and can make the physical aspects of providing care much more difficult. As the function of the brain becomes more impaired, individuals with dementia experience more difficulty understanding their environment and the world around them. Think about what it would be like for familiar routines, places, or people to be no longer familiar. And as their language declines, it becomes more difficult for them to express what or how they are feeling, unable to express their needs and concerns. While we can't change the course of the disease, we know that to some extent the behaviors we are seeing are related to the environment. So knowing this, we may be able to change the behavior by changing the environment. For an example, if your family member is becoming agitated, look for triggers of this agitation. You may notice that the television is loud, the lights are bright, there is just way too much stimulation. So you may be able to reduce their agitation by focusing on the environment, by reducing the stimulation and providing a more calming environment. As human beings, we all have the same basic needs. These include physical, psychological, and social needs. We do things consciously and unconsciously to meet these needs. The symptoms of dementia can make it more difficult for someone to do this. When people living with dementia cannot effectively communicate their needs, including basic needs such as being hungry or needing the toilet, or symptoms of pain or discomfort, this need is then manifested as a behavior. For example, when your family member doesn't recognize their surroundings, they may begin pacing and becoming more agitated, stating, "I want to go home, I want to go home." This is because they're not recognizing where they are. Their environment is not familiar to them. So behaviors are often the way that the person living with dementia is trying to communicate their needs. It is important to keep in mind that behaviors are a symptom of the dementia, not the person. They are not a choice. Your family member isn't behaving this way on purpose. There's always a reason or something that triggers the behavior. The behavior is their way of adapting to their environment. So how can we as caregivers support our family members and help to reduce these behaviors that challenge us? We will find ourselves taking on the role of a detective, identifying the behavior and trying to determine what could be the possible triggers. What is my family member experiencing that may be triggering this behavior? Is there something in the environment that could be a possible trigger? This could be noise, pain, discomfort, too many people, changes in routine. Triggers could also be medication side effects, unmet physical needs such as lack of sleep or feeling isolated and lonely. Can you try to prevent these triggers by identifying what they may be? If you can't prevent the trigger, can you identify the needs that your family member is unable to communicate and then help to address these needs? What interventions can you try to modify the effect of the trigger and then evaluate to see if your intervention or strategy has worked? Rudy, a caregiver to his wife and a member of our Latino Advisory Council, recognizes the changes in perception and thinking that his wife is experiencing as her dementia progresses. He states, "I need to validate her feelings and redirect. She is no longer in my world. I need to enter her world to try to understand what she is feeling and why." Rudy recognizes the importance of trying to see things from his wife's perspective. The first thing when you observe a behavior is to think about physical needs. Is your family member in pain? Is your family member needing their hearing aids or glasses because they're not sensing their environment properly? Are they hungry, thirsty, tired? They may be experiencing these physical needs, but unable to communicate them to you, and then these needs are exhibited as behaviors such as restlessness, agitation, irritability. Are they on a new medication? Is there too much stimulation? Competing noises can cause them to become more agitated. Have there been too many changes in their routine? Routine is so important to the person living with dementia. I want to emphasize that sudden changes in behavior are often caused by a physical health problem such as constipation, pain, or a urinary tract infection, especially when your family member seems to be more agitated, confused, or distressed. If you notice a sudden change, it's always a good idea to speak to your family doctor who can check for any physical problems and arrange any necessary tests such as blood or urine tests. Also ask the doctor to review all medications your family member is taking, including non-prescription drugs. We will discuss further these physical health problems in later sessions. In addition to physical needs, are their emotional needs being met? They may not always understand what you're saying to them, but they can understand how you say it to them. For example, if they are repeating questions, try to be patient and sensitive towards them. They may not know that they have repeated themselves, but they may notice if you seem impatient, which might distress them. Are they being treated with dignity, included in the conversation, being talked to as an adult and not using baby talk? Are they feeling afraid, anxious, or sad? Do they sense anger or frustration in the people around them? Is their independence being supported? Are they being given choices? Or do they feel like all their choices are being taken away? So how do we approach change? First of all, you want to work on one behavior at a time, trying to identify possible triggers that may be causing that behavior. It can be helpful to keep a diary of the behavior and the circumstances around it, looking for patterns in the behavior. When and where does the behavior happen? Does the person always behave in the same way in the same place? Does it always happen with the same person or in similar circumstances? Look for triggers for the behavior. Recognizing these may help you prevent the behavior from happening again. For example, if you find that your family member becomes agitated in the morning, you may notice it is always when you talk about their bath or shower, and they may state that they already bathed or they don't need to bathe. In thinking about bathing, could it be that they think that they've already washed or they have forgotten the steps of how to wash themselves? There may be physical reasons such as pain, or they may find the temperature too hot or too cold. So you want to start with communication strategies. How can you phrase this for them? These can be the most effective strategies, how you're talking to your family member. And in a few minutes, we'll hear more from Dr. Norman about communication strategies. Finally, you want to try one strategy at a time and evaluate and modify as needed. And you may need to try that strategy for several weeks before you will see a difference. I want to briefly discuss the role of medications in treating behaviors. Antipsychotic drugs should only be prescribed by a doctor as a last resort if other treatments have been tried and didn't work. They should only be used if the person's behavior is persistently causing them severe distress or putting them or others at risk of physical harm. Even then, they should be used alongside non-drug approaches based on the person's need. If antipsychotics are used, the doctor should monitor regularly how they're affecting the person. We have discussed the importance of the environment and how modifications to the environment can help to manage behaviors that challenge. Routine is so important, and it's important to help your family member maintain consistent routines. And that routine should be based on what your family member is used to and what works best for them. You know your family member better than anyone, so you can help create a routine that will work for them. Consider placing more difficult tasks at a time when your family member is at their best, which is often earlier in the day. Recap: BPSD, or behavioral and psychological symptoms of dementia, are symptoms of disturbance in perception, thoughts, behaviors, and mood that occur among people living with dementia. They are a symptom of the disease, not the person. They're not a choice by the care recipient. They can best be understood as adaptive behaviors, how your family member is trying to adapt to their environment. Our role as caregivers is to try to identify the triggers, to intervene with that behavior, and then to evaluate the effect of our approach on the behavior.